When it comes to our health, taking care of our physical health may seem a bit more straightforward than learning to take care of our mental health.
And joining us today and sponsoring our segment, our friends from Carle, as a great resource in our community with a creative way to care for our mental health. Ashley Cosby, registered art therapist and licensed clinical professional counselor, joins us. Glad to have you here with us, Ashley. As we know that mental health is so important to prioritize as something that we care for and we keep tabs of. I have not heard of art therapy, though. This is such a cool new avenue for people to be able to take. What is it?
Well, many people haven't heard of art therapy, so I'm grateful to be here and talk a little bit about it. Art therapy, it's a way to do therapy without the need to rely on verbal processing all the time. So it's where we use the creative process throughout the sessions, throughout treatment, to really kind of dig into things that maybe are difficult to describe in words. One of the ways I like to explain it to my patients is that we've all had experiences that are difficult to put into words. And so art therapy can kind of become the bridge to those words or become those words altogether.
So it's not art class.
No, that's the beauty. One of the wonderful things about art therapy is that it's not art class. I'm not an art teacher. You'll never get a grade. The work you make, I often will tell people, don't be surprised if it doesn't come out pretty, because our feelings aren't always pretty. Our experiences aren't pretty. And so expressing those things doesn't always look beautiful, but it's a beautiful process. And so the other piece that's wonderful about it is you don't need any art experience to benefit from utilizing it in treatment for mental health.
And how does it work? And how do you decide who would be a good fit for something like art therapy?
As an art therapist, I personally feel anybody could be a good fit for art therapy, but in general, as clinicians, we always take that into account. In our first meeting with somebody, we do what's called a consultation. And so we'll kind of talk about what they're looking for from therapy, what kinds of things they're struggling with, and then also explain the process of art therapy and see if it would be a good fit. The beauty of art therapy, too, is that all art therapists are also fully licensed counselors, so we can find the right fit for the patient between verbal and nonverbal processing.
We were looking at some of the examples of the artwork that some of your patients, I'm assuming, have completed. So when they come, is it like, okay, today we're going to make a ball, or today we're making a dish? How do you decide what we're doing?
Yeah, so all the art examples are actually just samples of mine, just for ethical reasons. We can't
beautiful
do
work.
Artwork. It just depends on the client, and the further the therapeutic relationship goes, the easier it is for me to see where a client is when they come in and what they're needing. Sometimes I ask them what they're needing, and sometimes they know intuitively, hey, I need to paint today. Other times I plan out more of a directive. Some of the ones that you've seen are multi-step projects where we kind of create something and then we might cut it up and then weave it together so that we can have kind of a parallel process or utilize metaphors within the treatment process that go along with what they're experiencing internally, but then pulls it forward. So it's really kind of a complex question because it depends very much on the person. I work with ages 3 all the way through adults. So
that was going to be my next question. Do you see more little ones or adults?
I do tend to have a majority of children and adolescents. However, art therapy can be used for any age, but I do think there's a tendency when you hear art therapy to think, oh, that's for kids. And so it's not, but it is very effective for children as well.
And therapeutic.
Yeah, and I bet those kids that are doing it now are going to start using that as a way to process their feelings as they keep going.
That's always the hope.
Yeah, absolutely. If people want to get in touch with you and maybe schedule their first consultation, how can they do that?
So you can start simply by going to carle.org.
Perfect.
Okay, well, we appreciate you coming, sharing a little bit about art therapy with us. Beautiful work.
Yes.
We will absolutely connect you after today's show at StayLiving.tv, and we thank Carle for sponsoring our health segment today.